Hey everyone, welcome back to the FU Cancer Podcast. Today we're diving into a topic that often goes under the radar, but is absolutely essential in the cancer journey: the role of foundations as a crucial support system in cancer care. Joining me is Melinda Bachini, a passionate advocate and the Director of Advocacy at the Cholangiocarcinoma Foundation, or CCF. Melinda is a 15-year survivor of cholangiocarcinoma and nationally recognized as a patient advocate. After a groundbreaking response to adaptive cell therapy in a clinical trial at the National Cancer Institute, her story gained national attention, including coverage in the New York Times. As the Chief Patient Officer for CCF, Melinda supports, educates, and inspires patients and caregivers. She brings lived experience and powerful advocacy to the forefront of cancer research and policy, serving on numerous national panels, including the NCI, ECOG-ACRIN, and the NCCN. A mother of 6 and grandmother of 4, Melinda uses her voice to champion hope, access, and innovation, sharing her journey from Capitol Hill to the White House. In this episode, we're going to explore what exactly cancer foundations are, how to start the search for the one that's right based on you or your loved one's needs, and most importantly, how patients and caregivers can get involved and truly become part of one of these powerful communities. Plus, Melinda will share some of the incredible work the team at CCF is doing to drive research, connect patients, and offer real compassionate support. Whether you're newly diagnosed, supporting a loved one, or looking for ways to give back, this conversation is packed with insight, inspiration, and practical guidance. So let's get to it. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Melinda, thank you so much for joining us today here at FU Cancer.
Thank you for having me. So happy to be here.
So let's start at the beginning. For those who may be unfamiliar, can you explain what a cancer foundation is and the different types of support they typically offer?
Sure. So I would start with saying a cancer foundation is usually an organization that forms in order to, help offer patients diagnosed with any type of cancer support. They want to offer patients support, caregiver support, but I think they also want to offer support to the medical professionals, the researchers, industry partners. I kind of consider a cancer organization the center of the wheel, the hub, right? Where the spokes reach out. Like we want to be the convener of all important, aspects that are working on cancer. So I would say we convene the patients, the caregivers, the physicians, the researchers, our industry partners, our regulatory partners, policy efforts, and all of that to bring everyone together, to be able to make progress and collaborate and provide innovation, with urgency.
Well, I think that's so important because especially if you or a loved one is newly diagnosed, it's super overwhelming. And, unless you've worked in healthcare and have that kind of baseline experience, I think you almost don't know where to start, right? You don't feel well and you're shocked, and now you've got all of this stuff to that kind of digest.
Exactly. It is so overwhelming in the beginning, for anyone who's diagnosed with cancer. And I think finding an organization that fits you is probably the hardest part, or knowing that they're out there and available.
So, what inspired your work at CCF, and really, how did you first get involved?
Yes, so I was diagnosed with cholangiocarcinoma 15 years ago. I was 41 years old, mother of 6, had no previous health problems, and this really came out of the blue. Um, and so I started searching. I'd never heard of cholangiocarcinoma before. And unfortunately, when you Google it, the statistics are pretty scary and overwhelming. And I did enough research to know that if I wanted to beat it, it was going to have to be something new. And so I started searching for clinical trials, and I asked my oncologist to be really proactive. But in the meantime, I happened to stumble upon the Cholangiocarcinoma Foundation. Nobody told me that there was an organization out there. I just accidentally stumbled upon it. And to this day, I hear from patients all the time that they wish they would have found it earlier, or that somebody would have told them about it. And at that time, there was just a discussion board online where patients and caregivers were meeting and sharing their experiences. And there wasn't a lot going on in clinical trials or treatment options, but everyone was sharing the information that they had gathered. And that's where the foundation started. They just started gathering this information. Stacy Lindsay started the foundation. Her brother was diagnosed with cholangiocarcinoma at 38 years old. And unfortunately, he only lived 18 months. But in that 18-month time frame, they gathered many, many resources. And before he passed, he asked his family to start a foundation so that those resources could be shared for those who came after him. And that's basically how the foundation started. And then for me, just having that plug-in. I will say in the beginning, it was really hard for me to read those stories. I had to keep my distance because I wanted to only hear positive things and really focus on that. And the discussion board, had real stories, and so I had to be careful. But what I did was go on, gather the information I needed, ask the questions I needed, and that was so helpful for me. But further down the road, I wanted that clinical trial, and 15 years ago, my insurance wouldn't cover the standard of care that went into participating in a clinical trial. And so I didn't even know that was a possibility. So I couldn't participate in that clinical trial. But some other cancer patients and I in Montana, we went to the Capitol, told our stories. There was a bill passed, a law passed that said insurance companies did have to cover the standard of care costs. But I couldn't, in the meantime, participate in that clinical trial. But that was the first time I really learned how to advocate and share my story, and really believed that by sharing your story, you could make a difference. And further down the road, I'm skipping quite a bit, but I did enter into a clinical trial at the National Cancer Institute, and I happened to be the first person to have a response, a really, really good response. And because of that, I really wanted to find a way to pay it forward. So I started volunteering with the foundation, and then later, 8 years ago, came on as full-time staff.
That's wonderful. I mean, that's such an inspiring story how you took something so stressful and impactful in your life and turned it into something positive. And I'm sure you're helping so many people.
I get so much more out of it, I think, than I give, for sure. I feel so blessed to be here and fortunate that I just want to find a way to help others.
So, aside from CCF, there are a lot of foundations available. So, how can an individual connect with foundations and really figure out what's best for them?
Right. I mean, I would start by searching for a foundation that's specific to your type of cancer. There's many foundations out there that serve, all cancer types. So it depends on what your needs are and what you're looking for. You can also ask your social workers at your cancer institute and see if they have any options or know any resources. But again, I would start slow and depending on what you're looking for, because it can be so overwhelming in the beginning. So there's many foundations that offer emotional support, they offer resources, some offer financial support. So again, it's finding what you need. But the first thing I would say is search that organization that is specific to your type of cancer, give them a call, find out what information they provide or what services they provide, and plug into one or two at a time and see what you can get from it. And then after that, I think you'll learn and you'll know what else is there and what can be more beneficial to you.
Are there any specific questions we should be asking when we are reaching out to a foundation so that we really get the whole picture?
Yes, I would definitely ask. Do you provide financial assistance? Many do, many do not, right?
Mhm.
And what's the first thing I should do? I was just diagnosed with this cancer. What is the first thing I should do? And I would say that most organizations, our cancer foundations, help you navigate that diagnosis, give you a pathway, give you the tools and the resources that you need to be a better patient advocate for yourself. Um, I would ask that. I would ask about mentorship programs, support groups, um, annual conferences, and then from there, anything else you want to get involved in, such as fundraising or policy efforts or sharing your story.
So let's talk about CCF. What are some of the key services and programs that your team offers to support patients and their families?
Yes, I'm so proud of the things that we're able to offer patients. We have a newly connected program that is for patients who are newly diagnosed or newly connected to the foundation. We offer a care kit, which is just a box filled with information, a nutrition resource, 100 question and answer book, and then just some little goodies. Nobody ever wants to be a part of this club, but unfortunately, if you are, we just want people to know that they're welcome and that we're here to support them. And along that newly connected program, we offer resources on how to get a second opinion, how to get biomarker testing or make sure you're getting biomarker testing done, how to search for clinical trials, and then how to plug into support. Some of the support services that we offer are we have online virtual support groups for patients, for caregivers, um, Spanish speaking one, and we also have a bereaved caregiver support group. We're just about to launch a young adult support group. We've been asked to do that, and so we're going to implement that here in the next month or so. And then also we have a one-on-one Cholangio Connect mentorship program. So we match you as best we can to a mentor who has been through what you're going through and can help you along the way. We don't offer medical advice, but we offer that emotional support where you have that one person you can reach out to and connect to when you have questions. And then that mentor can help you find those answers. Um, Other than that, we have an annual conference that we host every year in Salt Lake City that brings together over 500 individuals involved in this cancer type, the patients, the caregivers, the physicians, the researchers, industry, all sitting at one table. And it's one of those things that I can't describe in words. You have to actually experience it to understand the impact and how special it is. And then throughout the year, we offer regional symposiums at different institutions, which are one-day events at an institution. We have one coming up in LA at USC, and they'll bring providers or physicians, experts from their institution to speak on, chemotherapy options, clinical trial options, radiology, those kinds of different things. But it's open to patients and caregivers, and they have that opportunity to ask questions, but also to connect with others who are in the same, boat that they are, and really not feel so alone. And then along that line, there's so many other things, but we do educational webinars every other week where we have our industry partners or academia partners come in and talk about clinical trials. And then patients can log in and ask questions live and ask questions about the exclusion inclusion criteria or where they're being at and really understand the treatment options that are out there. We also do educational webinars on nutrition and side effect management and blood labs. What do the values mean? Why are they important to have? Different things along those lines.
How can individuals, whether they be a patient, survivor, caregiver, or an advocate, get involved with foundation work or other advocacy efforts?
Yeah, I think the biggest thing and the most important thing is just start by sharing your story. Reach out to the foundation. We always want to hear your story. Your personal story means so much. It puts a face to the disease. It can pass laws. It can help in fundraising. It can help in bringing awareness to it. So starting with that, they can get involved in so many ways. Volunteering to be a mentor, volunteering to do fundraising, volunteering for many other aspects. But you can become a volunteer, a fundraiser, and then just a patient advocate by sharing your story. It's amazing the difference you can make just by being a little vulnerable and willing to share your story. And by touching one other person, you've made a difference, and a very impactful difference.
Well, I'm sure that you've heard countless stories over the years. So, is there a story that comes to mind that you can share with us that really illustrates the positive impact that foundations can make on a person's journey?
I am fortunate enough to experience this almost every single day.
Mhm.
But there are so many different stories, and one just happened this week. There's a young 34-year-old man who was just newly diagnosed and, has a 2-year-old son.
Mm.
And he logged into our virtual support group and, asked some questions and listened. And then we set up a one-on-one time with him, just with our patient advocate, myself, and just gave him the time that he needed to answer questions. Because in the beginning, it's so overwhelming.
Mhm.
You're learning a whole new language. It's a whole new education on a topic you never wanted to have, and it's so overwhelming. And he was so grateful just to have that time and that information. And it gave him the questions and the roadmap he needed for
Mhm.
his next steps. And so every single day, I literally get that opportunity. Most of the time, it'll be patients or caregivers who are advocating on behalf of their patient. And when they do find us, they're so, like I said, incredibly happy for all the information that's available and the support that's available. But it always bums me out that it's later in their diagnosis. And I wish we could find a way to get every provider out there to let their patients know that there is an organization out there that can, provide the support and tools they need to help navigate. Because I believe with all my heart that if you can get plugged into a really good advocacy group, a cancer organization, I really do think it helps to extend your lifetime.
So, what advice would you give someone who maybe is at that point where they're feeling overwhelmed and they just don't know where to start to get the support that they need?
Yeah, I would say start slow and just bite-sized pieces, and that's where that roadmap is so important. Start slow, get the information you need, understand the diagnosis, make sure you're on the right track with a second opinion and seeing an expert in this disease, and that you know what all your options are. Um, and then move on to understanding the clinical trials. But one, take care of yourself first, right? You have to put yourself first before you jump in and want to help others. Um, there will be time for that. We always have patients who are so grateful for the help they receive. They want to pay it back right away. And I want that too, but I also want them to put themselves first, make sure they're in a good place, because there's always time to pay it forward later.
Well, we just have a couple of minutes left. So, what are some ways that our listeners can support the CCF and the work that you're doing, whether they're part of this community or if they just want to help out?
Just reach out to us. There's so many different ways to get involved. Like I said, we have so many volunteer programs between them, the mentorship program, and we have these groups called care team events that are set up in different areas across the world that we're really expanding, where we're wanting to bring awareness about this disease to help increase the funds so that we can eventually find a cure. There's so many different ways. But again, I think the number one way that I would say is just start by reaching out and sharing your story, where you're at. Let us offer support to you and come alongside you and support you and help you on the way. And then it just naturally takes effect where you become part of a family. It truly is a community.
Mhm.
One you may never have wanted to be a part of, but once you are, it's a community that embraces you, and you're never alone. And I think that's the most important thing that I hear from patients, is that they feel like they're not alone, and that they have hope again.
So, for individuals looking to get more involved, where's your website? Like, where can we find more information?
Yes, you can find us at cholangiocarcinoma.org on the web, or you can Google Cholangiocarcinoma Foundation and we should come up. And you can reach out to me anytime. I'm pretty easy to find if you Google me as well.
Wonderful. Well, thank you so much for sharing your time and your perspective with us. Your work and the work of foundations like CCF is such a vital part of the cancer care ecosystem. So thank you for all that you're doing.
Thank you for all that you're doing. We appreciate the opportunity to talk about the foundation and let others know that we're there to support them.
Well, listeners, if you found this episode useful, please share it with a friend or family member, and be sure to check out the FU Cancer website at fucancer.health. We've got a library of education that's been curated by experts specifically for you. So thank you so much for listening. Until next time, I'm Christina Rollins.